नमस्कार, मैं डॉक्टर सुनिंदर सिंह अरोरा हूँ, working in the prestigious Batra Hospital since 1989 and currently hold the post of the head of the Department of Internal Medicine, Respiratory, Sleep and Critical Care Medicine. I am also the founder member of the Indian Sleep Disorder Association. Batra Hospital was the first hospital in the city of Delhi to start the services of the sleep lab since 1996. God made a very beautiful body with two tubes, the windpipe and the food pipe, thereby getting oxygen from the wind and glucose from the food that we eat. This everybody understands. Food habits are intermittent, whereas breathing is a continuous process, just as our heart beats continuously without our control. But when the breathing gets stopped and starts, and especially in the night, it leads to a disorder called the sleep disordered breathing, also known as the obstructive sleep apnea. Obstructive sleep apnea is a disorder that caused by the relaxation of the neck muscles more than it is required, causing blockage of the flow into the lungs from the air and leading to asphyxia. That means low oxygen levels of the body. It's like getting strangulated. And then the body gets a signal to the brain and the heart and the lungs to reopen its breathing with a snore. And the choking opens up. So the commonest symptom of obstructive sleep apnea that we find is a fragmented sleep. People are unable to sleep comfortably in the night. They choke, they get up with a start, they snore heavily. The wife or the husband will tell us that they can't sleep because their partner is snoring. They get up in the morning with a headache. They have a very groggy morning. They cannot concentrate on their work, and they can also have decreased sexual libido. So all these symptoms are so subtle that they get surpassed as chronic fatigue, until and unless the oxygen that desaturates during the night brings maximum symptoms in the body. And they occur with a daytime somnolence, meaning thereby that you start sleeping in the day and you cannot keep yourself awake. People have had accidents, both while driving or in the industry, with grave complications. So the cause and the etiology of this disorder is well known. But why does it happen? It happens because there is a huge muscle mass around the neck, which then relaxes to an extent which makes the airway floppy. That means it cannot maintain its diameter while sleeping in the night to let the air flow into the lungs. And because of this closure of stopping and opening of the lungs, this disease brings these effects. So to diagnose this disease, one must undergo a sleep study, which is called a polysomnography, which is divided into two components of a diagnostic sleep study, and then the treatment part. The treatment part includes a very simple mechanism whereby an air compressor is attached with a tube to the mask on the waist with straps, and one can breathe comfortably, which makes the airway open all through the night and maintain the oxygen saturations. So if you have any of these symptoms, or if you are obese, or you have hyperthyroid, or you have a cardiac disease, or you have hypertension, or you have diabetes, or you have any other complication which defies a diagnosis, the root cause is obstructive sleep apnea. Now that it has become so evident in the country, with almost 4% of the population getting affected by obstructive sleep apnea, it is important that we recognize these diseases and then treat accordingly. Once we start using these non-invasive positive airway pressure machines, the physiology reverts back to normal and people get back to health. Thank you very much. Namaste.